Hi viewers, today our topic is fetal circulation. Already last video we have discussed about the normal adult circulation, and today in this video we are going to discuss about the fetal circulation. This fetal circulation is running between the three things. One is fetus, placenta and the umbilical cord. This umbilical cord is having one umbilical vein, two umbilical arteries. Umbilical vein is carries oxygenated blood from the placenta to the fetus. Two umbilical arteries are carries the deoxygenated blood from the fetus to the placenta for the purification. And in this video, this is the structure of the placenta, and this placenta is giving nutritional supply to the fetus, and also it is eliminating the waste products from the fetus, and also it is giving the respiration to the fetus and also blood circulation. Okay, and from the placenta, okay, this placenta is having attachment. Center of the placenta is having attachment with the umbilical cord. This is the structure of the umbilical cord. This is the umbilical cord. One side it is having attachment with the placenta, another side it is having attachment with the fetus. This umbilical cord is having the attachment with the two sides. One side with the placenta and another side with the fetus. And from the placenta, the umbilical cord. In the umbilical cord, there is a one umbilical vein is there. This umbilical vein is carries the oxygenated blood from the placenta to the fetus. Okay, umbilical vein carries the oxygenated blood from the placenta to the fetus, and this O2 blood is entering to the inferior vena cava with the help of special connection. This is the special connection is present in the liver. Okay, first O2 blood is entering to the liver, and from the liver it is entering to the inferior vena cava with the help of special connection that is called as ductus venosus. This special connection is called as ductus venosus. The ductus venosus is a special connection is present in the liver to receive the oxygenated blood from the placenta. And now this blood is present in the inferior vena cava, and as well as from the inferior vena cava, from the lower part of the inferior vena cava, there is a deoxygenated blood is there. From the inferior vena cava, the deoxygenated blood is coming from the lower body parts, and this liver blood and this inferior vena cava blood is entering to the right atrium. Actually, this right atrium to the this blood has to move to the right ventricles. In the normal adult circulation, right atrium to right ventricles. Okay, but in the fetal circulation, the blood is moving from the right atrium to left atrium, right to left shunt, with the help of foramen ovale. Foramen ovale, there is the right atrium to left atrium. This blood is moving 80% oxygen blood is moving from the right atrium to the left atrium, and from the left atrium to this blood is moving down to the left ventricles. And in the left ventricles, already you know there is a presence of aorta. There is a starting of aorta. Okay, this aorta is receiving the and transferring the this O2 blood to the fetus. And one more side, from the superior vena cava, there is a deoxygenated blood is coming from the superior vena cava, and this blood is entering to the right atrium, and this blood is very little amount is entering to the right ventricles. These right ventricles are empty. Why? Because actually in the normal adult circulation, the blood is purifying in the lungs. Right atrium to right ventricles, then it is moving to the pulmonary artery, and it is moving to the lungs after purification. Okay, in the lungs, and the blood is coming back to the left atrium to the left ventricles, and it is moving to the aorta. That is the normal adult circulation. But in the fetal circulation, from the superior vena cava, this deoxygenated blood is moving to the right atrium, and then very little amount of the blood is moving to the right ventricles. And this right ventricle blood is moving to the pulmonary artery. This is the pulmonary artery. But in the fetus, the lungs are immature, not functioning properly. So due to this reason, this superior vena cava blood is entering to the right atrium, and this is entering to the pulmonary artery. Very little amount of the blood is can able to move into the lungs, and remaining blood is present in the pulmonary artery and in the right ventricles. That's why there is an increase in the pressure in the pulmonary artery and the right ventricles. Why? Because this is empty itself with the vessels, and also the lungs are immature, not started function properly. Due to this reason, this blood is coming from the superior vena cava, right atrium, and to the right ventricles, and it is entering to the pulmonary artery, but the blood cannot move into the lungs. Due to this reason, there is increasing the pressure in the pulmonary artery. Due to this pressure, there is a formation of special connection between the pulmonary artery and the aorta. This is the special connection. This special connection is called as ductus arteriosus. Okay, this special connection between the pulmonary artery and the aorta is called as ductus arteriosus. Now, with the help of this ductus arteriosus, this blood, this superior vena cava blood is moving to the aorta, and then it is passing through descending aorta, and with the help of two umbilical arteries, again this deoxygenated blood is moving back to the placenta for the purification. And again in the placenta, the blood is purifying with the help of one umbilical vein. Again it is moving to the liver with the help of ductus venosus, and it is entering to the inferior vena cava, and then it is right atrium to the left atrium, then it is moving to the left ventricles, and then it is moving to the aorta and to the overall body parts. And one more side, from the superior vena cava, the deoxygenated blood is coming to the right atrium and into the right ventricles, and from the right ventricles to the pulmonary artery. But the lungs are immature here, that's why most of the blood is storing in the pulmonary artery, and there is increasing the pressure in the pulmonary artery due to there is a formation of special connection between the pulmonary artery and the aorta. So that's why this blood also moving to the descending aorta, and it is sending back to the placenta for the purification with the help of two umbilical arteries. This is about the fetal circulation. I hope you all are understand about the fetal circulation. Thank you so much.